This is a 24/7nursetutors.com lecture. 24/7 Nurse Tutors, providing unlimited tutoring.
Welcome, and thank you for joining us.
The EKG lecture.
Part 2.
Can you please tell me what this rhythm is? This is atrial fibrillation. Can you please tell me what this rhythm is? This is atrial flutter. Atrial flutter is a cardiac arrhythmia characterized by atrial rates of 240 to 400 beats per minute and some degree of atrioventricular node conduction block. Signs and symptoms in patients with atrial flutter typically reflect decreased cardiac output as a result of the rapid ventricular rate. Typical symptoms include the following: palpitations, fatigue or poor exercise tolerance, mild dyspnea. The pulse may be regular or slightly irregular. Hypotension is possible, but normal blood pressure is more commonly observed. Treatment goals for symptomatic atrial flutter are similar to those for atrial fibrillation. These include controlling the ventricular rate and restoration of sinus rhythm. Calcium channel blockers and beta blockers can be used. In atrial flutter, there are flutter waves. The rate of the flutter waves can be 250 to 350. The ventricular rate is often between 150 and 170. There can be variable conduction, 2 to 1, 3 to 1, etc., meaning there are 2 flutter waves for every QRS, etc. The QRS is normal. What rhythm is this, please? You are seeing sinus tachycardia. Let's talk more about it. Sinus tachycardia is normal except the heart rate is greater than 100 beats per minute. In surgical patients or trauma patients, this is often an indication for fluid replacement. Atrial tachycardia has a low mortality rate, and treatment is often directed at determining the underlying cause. Diagnostics include 12-lead EKG, a CBC, chemistry panel, and other diagnostics to determine the cause. Again, patient assessment is essential. For example, low urine output and thirst could be an indicator of hypovolemia. Can you tell me what this rhythm is, please? If you said sinus bradycardia, then go get yourself a cookie after you finish EKGs. Sinus bradycardia can be defined as a sinus rhythm with a resting heart rate of 60 beats per minute or less. However, few patients actually become symptomatic until their heart rate drops to less than 50 beats per minute. Sinus bradycardia rarely requires treatment and is actually common in some patients. Let me tell you what happened to me. I once cared for a professional football player who was having surgery. I don't recall what the surgery was, but his resting heart rate would dip into the upper 30s. I was like, oh my! But the good news was he was fine. I only had to wake him up a couple of times to be sure. I have had other patients that were athletic that had very slow heart rates and were fine from a cardiac perspective. However, their hearts were very efficient. I've seen cardiac outputs frequently at 10 liters per minute. I also had one trauma patient where we were able to push his cardiac output to greater than 17 liters per minute with inotropes. Unfortunately, he did not survive. He was a severe trauma patient who eventually succumbed to sepsis. We will talk more about sepsis later. Bradycardia. Everything is normal except the heart rate is less than 50. Again, some may say 60. Okay, can you tell me what these two rhythms are? What you see on your screen are ventricular fibrillation and ventricular tachycardia. Let's discuss them further. If you said the top is ventricular fibrillation, you're right. The bottom strip is ventricular tachycardia. In ventricular fibrillation, there's an undulating waveform. There are no P waves, no QRS, and you're in an emergency situation. Again, check your patient. Ventricular fibrillation is a life-threatening cardiac arrhythmia in which the coordinated contraction of the ventricular myocardium is disorganized. VF usually ends in death within minutes unless prompt action is taken. The rate of survival in out-of-hospital cardiac arrest has increased with expansion of community-based emergency rescue systems and the use of automatic external defibrillators. In the hospital setting, current ACLS guidelines should be followed. Again, check your patient. Remember, you are more than a conqueror and you will be successful. Join me as we review core content in the next unit.